Hi, do you get more than one period in 1 month? Or do you get one period every 2 months or every 3 months? Welcome back to Time with Lydia, the pharmacist. Today I'm going to be talking about why you might have two periods in 1 month, or why you might have one period every 2 months or every 3 months, or what we all know as irregular periods. Irregular periods are not always a sign of a problem, but sometimes it's a good idea to see a doctor about them just in case. You have irregular periods if the length of your menstrual cycle, that is the gap between your periods starting, keeps changing. A normal cycle from the first day of one period to the first day of the next can be anywhere from 21 to 35 days. We all think that 28 days is the normal cycle, but there is actually some room for variability. To determine whether your menstruation schedule is irregular, what you need to do is count from the last day of your previous period and stop counting on the first day of your next. Repeat this for 3 months. If the number of days between stopping and starting your period is outside of the 21 to 35 days range, then you have an irregular cycle. So why do some menstrual periods become irregular? And this is the question we are going to answer today. The reason why you have more than one period in a month, or you have just one period every 2 to 3 months, or even more. So we are going to be looking at some causes of irregular periods. So there are many things that can affect the length and timing of your menstrual cycle. Some can be corrected, but others can signal significant medical issues. Some are disease related and some are not. So the first thing that I want to talk about that is likely to cause an irregular menstrual period is thyroid or pituitary disorders. Hypothyroidism, hyperthyroidism, or hyperprolactinemia are all conditions that can affect your menstrual regularity. One study that was carried out found out that 44% of the study participants with irregular periods all had thyroid problem. Another disease-related cause is polycystic ovary syndrome. Polycystic ovary syndrome is a condition that causes issues with ovulation and the function of your ovaries. When ovulation is hindered by the condition, it disrupts the regular menstrual cycle. As a result, a person can experience irregular periods and vaginal bleeding. As many as 85% of people with polycystic ovary syndrome will experience abnormal vaginal bleeding. The next possible cause is birth control pills. Hormonal birth control pills can lead to irregularities in your hormones. Progesterone-only birth control pills may lead to bleeding in between periods. Also, individuals who stop their birth control pills may experience irregular periods for months. Another reason why you might be having two periods in 1 month, or one period every 2 to 3 months, or even more, is uterine polyps and uterine fibroids. Uterine polyps and fibroids are growths that attach to the wall and lining of the uterus. This leads to heavy bleeding, irregular bleeding, and pain. Another cause is endometriosis. This condition causes endometrial tissue to grow outside of the uterus. It can cause abnormal bleeding and significant pain with periods. Uncontrolled diabetes can also cause irregular menstrual bleeding, and the reason is that high blood sugar levels alter the hormone levels in the blood and change the menstrual cycle. Fortunately, treating type 1 or type 2 diabetes can help periods become more regular. Cancer can also cause irregular menstrual bleeding. It's not as common as other reasons, but menstrual changes, including 2 periods in 1 month, can sometimes be a sign of cancer. Cancers of the reproductive organs, including the uterus, the cervix, and ovaries, can change your hormones and menstrual cycle. Uterine cancer can cause you to have periods more often, and cervical and ovarian cancers are more often associated with long and heavy periods rather than more frequent periods. So now let's move on to non-disease related causes. Some of these causes can be modified and your period can be regularized. So the first one is perimenopause. Perimenopause is the transition to menopause, which can last as long as 10 years. Your menstrual cycles will become erratic as part of the process. It's been estimated that 70% of women experience menstrual irregularities in the approach to menopause. The next non-disease related cause is stress and anxiety. Chronic stress or even short-term anxiety about a specific problem can cause hormone imbalances, causing a missed period and irregular cycle. Another cause is extreme exercise, that is exercising too much. Extreme exercise can throw off the timings of menstrual bleeding and sometimes can even stop it. One other reason is eating disorders, extreme dieting, or weight loss. Being underweight, whether from extreme exercise, dieting, or eating disorder or illness, can have the same effect. Age can also be a cause, and as I mentioned earlier, perimenopause and menopause have a major effect, and being young also, that is early puberty, can create irregularities as well. Once menstruation begins in young women, it can take several years before it falls into a pattern. So now you see there's so many reasons why a woman might be experiencing irregular menstrual periods, or might be having 2 periods in 1 month, or 1 period every 2 to 3 months. The next question we want to answer is treatment always necessary? In some cases, you may not require treatment for abnormal vaginal bleeding because the underlying cause isn't serious. For example, if you have just started taking a new form of birth control pill and you are experiencing bleeding between your periods, the best option may be to wait so that your body can adjust to the contraceptive. Sometimes too, there might be a reason for you to visit your doctor, and I'm going to be talking about when you need to visit your doctor and some treatment options available for irregular menstrual period in my next video. So make sure you don't miss the video. It's going to be really interesting. I hope you have learned something new today. Please give this video a thumbs up. Share this information with family and friends. You know, so many women suffer in silence with irregular menstrual period. They feel shy to go and speak to a medical doctor or to even pop into the pharmacy and speak to the community pharmacist. So do share this video with your friends and family so an awareness can be created about irregular menstrual periods. Thank you once again for your time today, and I hope to see you soon in my next video. Bye for now.